Can men get pregnant?
I
You're a
totally
doctor, I
agree.
think.
Science and evidence should guide medicine.
Do science and evidence tell us that men can get pregnant? Biological men, can they get pregnant?
I also think yes/no questions like this are a political tool. And
No, yes/no questions are about the truth, doctor. Let's not make a mockery of this proceeding. This is about science and evidence, and I'm asking you. You know, the United States Supreme Court just heard arguments yesterday at great length on this question. This is not a hypothetical question. This is not theoretical. It affects real people in their real lives. And you're here as an expert, called by the other side as an expert, and you've been telling us that you follow, right, you're a doctor, and you follow the science and the evidence. So I just want to know, based on the science, can men get pregnant?
What began as a routine Senate hearing quickly turned into one of the most tense and revealing exchanges in Washington this week. Senator Josh Hawley, a Republican from Missouri, confronted Dr. Nisha Verma with a question that has become a flashpoint in America's cultural and scientific debates, a question he framed not as political, but as foundational. Can men get pregnant?
Dr. Verma, I wasn't sure I understood your answer to Senator Moody a moment ago. Do you think that men can get pregnant?
I hesitated there because I wasn't sure where the conversation was going or what the goal was. I mean, I do take care of patients with different identities. I take care of many women. I take care of people with different identities. And so that's where I paused. I think, yeah, I wasn't sure where you were going with that.
Well, the goal is just the truth. So can men get pregnant?
Again, the reason I paused there is I'm not really sure what the goal of the question is.
The goal is just to establish a biological reality. You just said a moment ago that science and evidence should control, not politics. Absolutely. So let's just test that proposition. Can men get pregnant?
I take care of people with many identities, but
can men get pregnant?
I take care of many women that can get pregnant. I do take care of people that don't identify as women.
Can men get pregnant?
Again, as I'm saying,
let me just remind you what you testified to a moment ago. Science and evidence should control, not politics. Absolutely. So can men get pregnant? You're a doctor, I think.
Science and evidence should guide medicine.
Do science and evidence tell us that men can get pregnant? Biological men, can they get pregnant?
I also think yes/no questions like this are a political tool. And
no, yes/no questions are about the truth, doctor. Let's not make a mockery of this proceeding. This is about science and evidence, and I'm asking you. You know, the United States Supreme Court just heard arguments yesterday at great length on this question. This is not a hypothetical question. This is not theoretical. It affects real people in their real lives. And you're here as an expert, called by the other side as an expert, and you've been telling us that you follow, right, you're a doctor, and you follow the science and the evidence. So I just want to know, based on the science, can men get pregnant? That's a yes or no question. It really is, I think.
I think you're trying to reduce the complexity of a lot.
I'm not. I'm trying to get, it's not complex. I'm trying to get to an answer, and I'm trying to test, frankly, your veracity as a medical professional and as a scientist. Can men get pregnant?
I think you're also conflating
This is extraordinary.
Female with
No, I'm not conflating male and female. They're two different things. There's biological men and there's biological women. And I want to know, can men get pregnant?
What you were talking about is biological.
You're not going to answer my question.
Biological males.
This isn't hard, doctor. Can men get pregnant? Yes or no?
Again, I would be more than happy to have a conversation with you that is not coming from a place of trying to be polarized and push.
I'm not trying to be polarizing. I'm trying to ask. I think it is extraordinary that we are here in a hearing about science and about women. And for the record, it's women who get pregnant, not men. We are here about the safety of women and science that shows that this abortion drug causes adverse health events in 11% of cases. That's 22 times greater than the FDA label, another fact you haven't acknowledged, and yet you won't even acknowledge the basic reality that biological men don't get pregnant. There's a difference between biological men and biological women. I don't know how we can take you seriously and your claims to be a person of science if you won't level with us on this basic issue. I thought we were past all of this, frankly. I can't believe we're still here talking about this.
I am a person of science, and I'm also someone here who's here to represent the complex experiences of my patients, and I don't think polarized language or questions serve that goal. I don't think they serve the American people.
It is not polarizing to say that there is a scientific difference between men and women, and I want this to be clear and for the record. It is not polarizing to say that women are a biological reality and should be treated and protected as such. That is not polarizing, that is truth. It is also, by the way, the United States Constitution, which offers unique protections to women in a variety of circumstances as women. And your refusal to recognize women as women and men as men is deeply corrosive to science, to public trust, and yes, to constitutional protections for women as women. And I think it's extraordinary that you would sit here and advance a political agenda that has been thoroughly discredited and rejected by the American people in this forum. And I'm glad we had this exchange because it is exceptionally clarifying. It is also in many ways quite depressing. I see that my time has nearly expired. I just want to thank the other witnesses for being here. Thank you for protecting women and children.
Before we go any further, if you value clear, in-depth explanations of what's really happening in Washington, make sure you subscribe to the channel so you don't miss our continued coverage. Dr. Verma, a physician testifying as an expert witness, initially hesitated. She explained that she treats patients with a wide range of identities and experiences and said she was unsure where the senator was going with the question. Hawley immediately pressed back, insisting that the goal was simple: the truth. He reminded the committee that Dr. Verma herself had just testified that science and evidence, not politics, should guide medicine. This is where the exchange shifted from awkward to combustible. Hawley reframed the question again and again, stripping it down to what he called biological reality. Not identity, not lived experience, not social categories, but biology. He repeatedly specified biological men, asking whether, according to science and evidence, they can become pregnant. If you're finding this kind of breakdown helpful, take a moment to subscribe. We focus on context, not just clips. Dr. Verma resisted giving a yes or no answer. She argued that the question oversimplified complex medical realities and accused Hawley of using a political framing. Hawley rejected that outright. He said yes or no questions are not about politics, they're about clarity. And clarity is essential when lawmakers are crafting policy that affects real people, real medicine, and constitutional protections. This moment matters because it highlights a deeper divide that goes beyond one hearing. Hawley was not just challenging Dr. Verma's answer, he was challenging her credibility as an expert witness. In his view, if a medical professional cannot affirm what he considers a basic biological fact, then their authority to speak on women's health, abortion policy, and medical safety is fundamentally undermined. Subscribe now if you want these high-stakes moments explained in plain language. Hawley tied the exchange directly to abortion policy, pointing to studies suggesting higher rates of adverse events from abortion drugs than what appears on FDA labels. He argued that the hearing was supposed to be about women's safety and medical science, yet he claimed that the same science was being blurred or avoided when it came to defining who women are biologically. Dr. Verma responded by saying she is a person of science and also someone who represents the complex experiences of her patients. She argued that polarized language does not serve medicine or the American people. Hawley countered that acknowledging biological differences between men and women is not polarization, it is truth, and that denying those differences erodes public trust in science and weakens constitutional protections specifically designed for women. If this kind of deeper analysis helps you cut through the noise, don't forget to subscribe. It really helps the channel grow. What makes this exchange especially significant is that it didn't happen in a vacuum. Hawley pointed out that the United States Supreme Court had just heard arguments touching on these same issues, meaning the definitions debated here could influence how laws are interpreted, enforced, and challenged nationwide. This is not just academic. It affects medical regulations, sports, prisons, abortion law, and sex-based legal protections. By the end of his time, Hawley made it clear he believed the exchange was clarifying, not just for lawmakers, but for the public. Clarifying, he argued, because it exposed a fundamental disagreement over whether biology can still serve as a stable foundation for law and medicine in the United States. And if you want to stay informed as these debates continue to shape policy and culture, make sure you're subscribed. We'll keep breaking down the moments that matter with context you won't get from sound bites alone. This hearing wasn't just about one question. It was about whether science has a shared definition in public policy, whether expert testimony can avoid cultural debates, and whether lawmakers and witnesses are even speaking the same language anymore. And judging by the tension in that room, this conversation is far from over.